what is the best anti-aging skincare for her.
So today it's gonna be another Skin Deep conversation where beauty meets science and stories meet skin.
We have a shared expertise of 20 years in the beauty industry, in the aesthetic field, and we are here to share what we have learned along the way. Ayan guys, so you might have noticed you're in a coffee shop, so we're just going to have a quick chat with your beauty bestie, Dr. Arlie. And you can see, we also ordered some breakfast for us, and we're going healthy today. So this is watermelon salad, and this is matcha cafe. So join us as we have our coffee break this morning.
As we go on with our coffee, we're gonna be discussing different consults. So for today's episode, we're gonna be opening our channel for your concerns and your consults. We're gonna be showing our sample patients to discuss some skin issues.
Oh yes, alright guys. So from our previous episode, we have received a question from a patient. And you know, sabi niya Dr. Arlie, she's 45 years old. She's someone working at the BPO industry, female. And she has noticed some skin problems like pecas and wrinkles. So we're gonna show the question here.
Yes, okay. So this is our index patient. So as you noticed, I'm sure all of you guys are gonna agree that she's actually looking younger for her age. She's already 45, but the wrinkles are not that visible yet, and the skin is still tight. But just some minor concern, the quality of the skin, it's a bit dry. Patient admits na hindi siya ganun strict with skincare. And also, you would notice under the eyes, medyo dry na yung skin and very prominent din yung pores ni patient.
Yeah, so ayan na, sabi ni Dr. Arlie nga yung patient natin, ang kanyang skin concern. So, Dr. Arlie, anong usually yung ginagawa mo for like this types of patient? Kasi, syempre, I just wanna say pala, Doc, yung mga clinics natin, can you tell me more about your clinic?
You can visit me at Idara Aesthetics every Thursday, Saturdays, and Sundays from 1 p.m. to 7 p.m. And for those naman na in Quezon Avenue area, I also work in our Rus Scout Rallios and sa Your Desire Aesthetic Clinic at Creekside Tomas Moreto Building.
Yan. So for me, I'm gonna show this naman. This is my clinic, Ada Viva Clinic. And so we've been in the industry for 13 years. So we have different clinics that we work at. And for sure, we also have different experience with patients. Not because ito yung nakikita naming patient, we have the same way of treating it. So I just wanna get your opinion, Dr. How do you usually treat this patient? Because she wants to know what is the best anti-aging skincare for her.
Procedures for this patient, I would recommend skin boosters and biostimulants. For this patient, although wala namang masyadong evident na sagging ng skin, pero meron na rin po siyang prominence ng nasolabial fold. And of course, yung under eye na rin is medyo nagkakaroon na rin ng hollowness. So I would suggest injecting Profilo or skin boosters like Luhilo for improvement of quality of skin, for brightening ng skin tone, and for firming and lifting para ma-lessen yung prominence ng nasolabial fold. At the same time, yung darkness din is ma-lessen din. And I would partner it with either Reduran or other PDRN brands of skin boosters or Exosome to improve the overall quality of skin. And as you can see, very prominent yung pores kasi ni patient to achieve the more firm and glassy skin and healthy and younger looking with very subtle changes.
Oh, yeah, I would agree with your with the full assessment of the patient and also with the use of skin boosters. Like as Dr. Arnie mentioned, like if you've heard the Reduran, the Profilo, and what was the last one?
Oh, exosomes.
Exosomes.
Any brand of human exosomes would be good. Depending on the preference naman ng pasyente, we offer different brand options naman.
Ooh, So honestly, I also tried using exosomes, and this was also with a patient who was around 60 years old, and that patient didn't have any other skincare done. And he would always tell me I would want to have exosomes done because he noticed that ang supple ng skin niya, less yung wrinkles, and more hydrated yung skin. So I think that's the result na gusto nating matching for her, for making her skin look more bright and less tired. And for sure, suppleness of the skin would make you look younger. You know, when I treat patients, I always have this peg in my mind. Like the idea of what is the ideal skin. And so, we treat them syempre, I would think na very individually. So, kung ano yung results na gusto nating ma-achieve sa kanila. On top of that, that's the reason why I ordered this today. So, I ordered the matcha latte and a salad because I want to promote, syempre, a good and healthy lifestyle.
Yes. With the work of our patient kasi, she works in the BPO industry. So, very common talaga yung shifting ng schedules and sleep deprivation. Even though yung nila, working hours is regular, usually they are on the grave shift. So, syempre, hindi pa rin ganun ka-quality yung sleep nila. Kasi when they go home, may disturbance pa rin. Kasi, syempre, we work on the daytime, tapos they work on an opposite timeline. So na-istorbo pa rin ang tulog. Very important pa rin yung 8 hours of sleep, and 8 to 10 glasses of water. And, of course, eat your vegetables.
Eat your vegetables, and syempre, I would also suggest exercising. Because what's healthy for within is healthy for your skin. Diba?
Yes!
For sure. Kasi syempre, we're also treating not only yung face, but also for the body. We wanna tone up yung skin natin sa katawan. Kasi prone din naman magsag yung skin natin sa body. At the same time, you know, when you exercise, parang you feel happy.
Yes, it's
Diba?
true. And also, most of this skin problems originate from lifestyle disease or lifestyle abnormalities, or meron tayong ideal na normal na lifestyle, which we always advise sa mga patients, but of course, not everyone can really follow that. Kasi syempre may iba-iba tayong background, iba-iba tayo ng work. So not everyone is gonna be able to prepare their own meal to follow a healthy diet. Syempre, lalo na sa mga nag-work sa mga
Nako, nakaka-relate
order
ako
na
dyan.
lang.
Nakaka-relate ako din kasi I don't know how to cook, honestly. So mag-order na lang tayo ng salad. Pero syempre, yan, mga antioxidants natin, we would suggest. It's also good to control syempre yung mga free radicals sa body natin. So that's why we need antioxidants sa ating diet, because the free radicals can destroy yung collagen and it can show up with our skin. And also, matcha is a good antioxidant, kaya ako nag-order ng matcha na din. And also, coffee.
Coffee for me, of course, with moderation pa rin, at least 1 cup lang per day. Wag gawing water ang coffee. Isa lang per day.
Totoo yun. Kasi nakaka-dehydrate din ang coffee,
True.
But antioxidant din siya.
Yes, meron din siyang antioxidant, but of course, in moderation, we maximize the benefit with just minimum dose of coffee. If once we overdo it, it's gonna make you dehydrated, and the next day you're gonna feel over fatigued then because of the after effect of the stimulation. And I always say this to my patient, the general rule is to eat your rainbow, the natural rainbow. Matcha for the green, red, watermelon, yung mga other rainbows ay colorful na natin, na mga food. The natural, the more the antioxidants.
And about this patient pala, before we end up the segment for this, ang concern din is pecas sa piscina. Matagal ata niyang tinitreat to with chemical peel eh. So how do you usually treat melasma?
Melasma. So, we always encounter these patients having complaint of hyperpigmentation, like freckles, melasma. Actually, before, hindi siya ganun ka-rampant. Konti lang yung mga cases ng mga ganito. But it became more common, lalo na after pandemic. I'm sure napansin mo rin with your practice. Kasi before, uso yung mga strong healing agents kasi. Okay. And they didn't follow through with the proper skincare. Like after mag-peel, mga si Marijude, mga gano'n, yung mga peeling
So,
sets.
dumami yung mga peeling sets after pandemic.
Yes, kasi
Yung successful.
those are okay to target some skin problems like uneven skin tone, like yung skin texture, para mag-improve, and of course yung mga patients with pimples. But the problem is kung may nag-undergo ka ng peeling, you make the skin more vulnerable because it's very young. Kasi parang inano mo siya, parang minadali mo yung pag-appear ng mga ilalim na balat. So, kumbaga parang pinilit mo siya. And once na na-expose siya sa direct sunlight, very prone siya sa sun damage. Kaya nagkakaroon ng hyperpigmentation.
I agree with you, Doc, kasi with our type of skin dito sa Philippines, we are prone to hyperpigmentation, and that would appear as melasma. So usually, nagkakaroon tayo ng trauma sa skin like acne, or na-expose tayo sa heat, na-expose tayo sa UV from the sun. Ang reaction ng skin natin to protect it is to form more pigmentation. So yan yung lumalabas yung melasma. And syempre, I would think that another part is nung pandemic, all of us are just looking at our screens, and
Yes.
there are studies that the blue light on the screen can actually cause damage and melasma din sa skin natin. That's why I would think that's how we would also prevent it, is using the sunscreen that what you mentioned kanina. So, even at night, kasi di ba tanong nila, should I wear sunscreen at night?
Yeah, for me, it's okay if you do your proper cleansing. Kasi syempre, sunscreen are very thick kasi the preparation, the consistency is very thick. It has the tendency pa rin to clog the pores. So syempre, yung mga patient kung hindi nila na-cleanse ng maayos yung skin, it would accumulate and would clog the pores and would predispose you to breakouts. So, ang advice ko lang sa mga nag-use ng sunscreen, they do the proper layering. If they do the proper layering, the sunscreen it's not in direct contact with the skin, thus it's very easy to wash off. Kasi may inner layer na mga na water soluble bago ka naglagay ng sunscreen. So, easy yung pagtanggal, and at the same time, kailangan may pasiguro ka na toner para yung excess dirt talaga ay madadala. Pag hindi nila nagagawa yun eh. So, syempre, it would lead to clogging ng pores at breakouts.
Yes, and also after pandemic, di ba mga people, mas naging sila, gumagamit yan yung mga rejuvenating skincare, but at the same time, naging uso din yung UV light, yung red light sa face. Pero because of the heat from that, there's also research that says na nakakakos din siya ng pecas. Nag-react yung skin natin na nag-cause ng hyperpigmentation. So, also watch out for those things. Kasi heat, trauma, like when nagkaka-acne ka, when you pick on your skin, it gets red, it will cause hyperpigmentation. So, we have to also control yung mga habits natin.
Those patients who prick their own skin, it's very dangerous because it's gonna be your skin is gonna be predisposed to infection. Best to have it done by a professional. Go to your skin clinic, schedule for a facial para ma-cleanse properly yung face nyo. Okay, so avoid pricking your skin and tapos kukut-kutin nyo with your kuko. It's gonna introduce bacteria on your skin. Okay lang sana if hindi siya kung hyperpigmentation lang ang concern. Pero if we prick our pimples on the danger triangle, the infection could easily travel to the brain. It's very dangerous. Kaya huwag niyo gawin yan.
For sure, you have to consult your doctors when you have a pimple in the dangerous triangle. So it's between the eyes, the nose, in the base of the nose, and on top of the mouth. So for that, it has a direct access niya sa brain. Pag the infection travels sa area na yon, we're gonna have more problems. So much better that you leave it to the experts. And I think we touched on a lot of things na rin with the patient for the melasma. But how do you treat this on your practice?
we advise them to undergo a program, laser therapy, to undergo people laser therapy to break down the pigments, and the body's gonna absorb it naman. And the process is very safe. Once the pigment is broken down, our white blood cell is gonna clean it up, and then it's just gonna go into our lymphatics, tapos maano na siya, lalabas lang siya sa dumi. But syempre, hindi siya magic na one-time treatment. You have to be dedicated in following the skincare. You have to be dedicated in going for the follow-up consults. Kasi kung hindi mo rin siya mapapanindigan, baliwala lang din yung effort and gastos. And of course, talaga, always wear your sunscreen. Ulit-ulitin mo talaga.
Yes, I agree with Dr. RD because with treating melasma, it is possible na recurrent yung melasma mo. As she mentioned, the pico laser, that's a good way to treat it. I usually combine yung pico laser and yung skin booster. So the skin boosters help in hydrating the skin. Because there's a study that if your skin is dry and dehydrated, when exposed to the sun, it's faster to develop the hyperpigmentation. So for me, I usually do the skin booster and pico laser at the same session to target yung both concerns ng skin for prevention and at the same time for treatment as well. And at the same time, may Luhilo Snow din, Dr.
Yes, the Luhilo Snow. We've touched on Luhilo Snow in our previous episode. So Luhilo Snow, it's a skin booster with hyaluronic acid for hydration, for better quality ng skin. It has orbitin, niacinamide. Both agents are good for lightening and for preventing of development of pigments. And glutathione, of course, is a whitening agent.
Gusto ko ng glutathione for sure. It's an antioxidant. It's an anti-aging product. It's good for your health and liver. As long as done by someone who is an expert, a doctor, it's going to be safe.
We have our natural glutathione. We have our natural glutathione that acts as a scavenger of free radicals. So, it acts as an antioxidant para man-neutralize yung mga toxins sa katawan natin.
Don't abuse it.
Yes! I'm sure you've seen kaliwat kanan ang dami nag-offer ng glutathione. It's always case-to-case basis. We assess the patient if okay ba sa pasyente yung treatment. And syempre, anything that's too much, may ano pa yan, although good ang glutathione, may ano pa yan for overdosage. Kasi syempre yung ibang go lang ng go para mabilis yung pagputi, tataasan din ang dosage. Pero syempre, depende pa yun sa capability ng patient.
Oh yeah, actually I have a lot of things to say about that. But for sure, you have to consult your dermatologist and your doctors to give you the real glutathione. Kasi we want to avoid, because it's a good product, we want to avoid na ma-abuse yan ng mga people. And then it can be harmful syempre if it's not properly done.
Okay, so it has been another productive day, and we are able to tackle all the concerns of our index patient. We are so thankful for the patient who shared her concern, and I'm hoping all others who wants to have their consult as well message us or comment down on the video. But mind you guys, this is not treatment for all. Although we gave advice for this patient, there's no assurance that it's gonna work for everyone. We do individualized treatment plan for different cases, so it's still best to book a consult with your doctor.
Yes, so guys, if you have questions, please comment below and we will try to answer those. Please follow us, subscribe, and keep supporting our channel. So,
again, this is Dr. RD.
Dr. Ada,
Keep glowing, keep growing,
and we'll catch you in the next episode.
see you mga ka-beauties!